I'll always be the man that home. I'll pick up mine, getting free to work. I'll pick up truck. That was home, baby. Home, baby, was a dirt road. Home made me crave some ice cold. Sweet tea, mama knows how to make.
Well, I'm going to talk to Joe and make sure he can.
There you go.
Okay, let's see if the GoToMeeting people can hear me now. Hello? Can you guys hear?
Talking.
Okay, I'm going to keep talking, and we're going to hope that we can get the technical issues figured out. So after we do our brainstorming, Colin Kingsbury will be with us to talk about autism in Utah. Again, our topic today is autism, going along with Autism Awareness Month. And then he'll wrap up around 9:30, and we'll move into some small groups, and I'll talk a little bit more about how we want to do that in just a minute to get you guys kind of prepared and ready.
Oh, still no.
Still no.
Muted. Unmuted.
Right now.
Okay, can you guys hear me? GoToMeeting folks, can you hear me?
That's an important question.
Now we can hear.
Okay, so you need to mute
Oh, I
yourself.
need to mute.
Just like a status update.
All right. Let's see if we can do this without feedback. Like it's working now. Okay, so now we'll do our introductions. I am Mindy Tueller, and a little delay on here. There we go. And I manage the Medical Home Portal, and I facilitate this meeting. And I think, if you don't mind, we'll just go to Dawn, and maybe we'll try and identify the folks on the monitor.
Sure.
There. Okay.
So I'm Dawn Bentley from UPIC, Quality Improvement Specialist. We have Aaron. Do you want them to introduce themselves?
You know,
Or do you want
maybe
me to
just for
just
the
read
sake of
them?
time,
Okay.
if you don't mind running through.
So Aaron Shoemaker is also from the U. We have Dusty Frisbee from Wasatch Peds Summit. Hi, Dusty. And Melinda Tibbles from Utah Valley Peds. I don't remember which office, actually. And Walt Torres from Integrated Services, or online.
And there's somebody else as well from, I think, Eric's group. I'm not sure. Just CSHCN as the identifier. So
It's probably Natalie Allen,
probably
if I had to place a bet on that.
Okay. So, yeah. And actually, it's really helpful for us to know who our GoToMeeting attendees are. Sometimes this is kind of all the information we get from them, or even we'll see that they're a caller. But it's really helpful for us to know. So if you can type in the chat box who you are, that's really helpful. Okay.
I'm Gabi Baragoshi. I'm also working for UPIC and helping Mindy with the medical home, and I'm also a quality improvement specialist with Don.
Greg Hawks with James Mason Centers for Recovery. I do the community outreach.
I'm Cassie Crane. I'm the care coordinator at Wasatch Pediatrics South Point.
I'm Jan Boker. I'm from Memorial Pediatric.
So Tillman, care manager.
Wesley Smith, care coordinator for Tri-County Health Department with the ISP team.
Hi, Eric Christensen with Utah Department of Health. I manage the Integrated Services Program team.
Heather Carlson, I'm a nurse, and I work for Eric Trio.
I'm Tony Estrada, and I work at Integrated Services Program as a care coordinator.
I'm Gwen Anderson. I'm a care coordinator for Eric's team in Carbon, Emory, and Grand County.
Welcome. Thank you.
Wendy Stevenson. I'm the care coordinator in Richfield for Integrated Services.
Thanks for being here today.
Chelsea Hamadou, also care coordinator for San Juan.
That's great. Thank you guys so much for making the trek. We really appreciate it.
I think she gets the award for furthest distance travel to be here this morning, so
Go, Kelsey.
good on you, Kelsey.
Wow, did you just join in this morning? No. Okay.
I am Linnea Bauer. I am the Services Support Manager for the Medical Home Portal.
I'm Rebecca Barker. I'm the care coordinator at the University Pediatric Clinic.
Chuck Norland, Director of the Medical Home Portal.
Heather Castor, Med Home for Wasatch Pediatrics in Draper.
Kay Haynes with the resources on the Medical Home Portal.
Gina Pulameni from Utah Parent Center and Utah Family Voices.
Folks walking in, that's great. We'll just keep it. We won't put you on the spot this morning. That's Colin, by the way, right there.
Hey, Colin.
Okay, just a few little housekeeping things for those who aren't familiar with this space. So if you have need for the bathrooms, just walk down this kind of first hall here, and you'll go past a little desk with somebody there, and after you pass that, there are bathrooms kind of in the central area of the building, and we are very informal, so feel free to do what you need to, get up and get food, what have you. If you do need Wi-Fi, there's a Blue Zone network here. There's a Wi-Fi option there. We are having this meeting recorded by USU, and they stop right at 10 o'clock. So we try and wrap up right at 9:59. But today's a little different because of our small group exercise. However, we do respect your time. Try and be on time and wrap up around. Okay, so I wanted to mention just a couple of things from our learning session last month, and I think many of you attended. A couple of follow-ups in that. Well, first I'll do the bottom three bullets. So we sent out with the resources of the month a PDF that included a link to this document. This is the Family Voices Toolkit, which is really, really good stuff, guys. We also have this as a link on the Medical Home Portal. So I recommend that you check that out if you haven't already. It's really great stuff, having to do with individuals who might have immigration issues. So if that might be useful to you, please check that out. We also made a PDF, I think, of this Utah Legal Services brochure, and that would have been linked to that email as well, and also on the Medical Home Portal. And then the Disability Law Center had a number of business cards that were extra, and so we've got those on the table if anyone would like to get a disability law informational business card. And then there was a question in the meeting about whether or not Social Security information reports to ICE and Homeland Security. I don't know if those of you who were there remember that. Gabriella Archuleta from Holy Cross Ministries followed up and says that, in fact, currently there are rules and laws permitting that. So yes, the answer is yes. And in our PDF that was attached to the email with the detail from the meeting, she has a number of other links that can provide more information about what the rules are around that. All right. Hopefully you guys all got some sort of a notification about Shriner's open house, which is going to be on May 14th. And it's from 11 to 2, and I understand that there's going to be presentations and tours and a free lunch. So if you're interested in that, May 14th at Shriner's in Salt Lake. And I've done that before, and it's really, they do a great job. It's really nice. It's terrific to have that tour. Just wanted to let you know about some of the updates on the Medical Home Portal. We have a new page that is screening for sleep problems. And then we have updated the following, these are all the full detailed diagnosis modules. And then we continue to update and improve our for family section. So there's too many pages to mention individually that have been hopefully improved in that section as well. And then we are just continuing on these other projects that we want to let you know that we're always trying to improve the Medical Home Portal. We have a major project around service provider lists and improvements to those. And we've got these other projects going on as well that will just overall, we hope, improve your center. And of course, just a shout out to let you know that we always appreciate your input. So if there's anything that you'd like to let us know is working, isn't working, that would be great. Please let us know. You can get in touch with me. There's a feedback link in the bottom of every page. Okay, so here's that heads up I was going to mention. So we want to, promptly at 9:30 to move into our small group exercise. You can see that we've got some things already set up here. The room immediately next to us, 148, is also ours, and we're going to ask that 2 groups move over there. And we're anticipating that our groups will be not too large, not more than 10, depending on if others come in. And what we would like to ask your help with is that if you'll stay with your organization, we think that ultimately what will come out of the exercise will be beneficial if you are in the same group as others in your organization. So we'll ask you to sort of help self-identify and self-separate in that way. And we'll have 2 groups over there and 1 group staying in here. And Linnea will be leading a group over in the other room, and Gabby will be leading a group for those of you on GoToMeeting, Dawn is going to work with you guys in a small group exercise on. Perfect, and we'll try and make that happen promptly at 9:30. Okay, so as I mentioned before, this is our brainstorming time, which is really when we let you guys just utilize the brains and the experience of this group. We're pretty much all, we don't have anybody on our extended remote site, so we're either in this room or on GoToMeeting. And we would just like you guys to feel free to speak up and let us know if there are any cases that you're having issues with. If you'd like to ask for some help, ask for ideas from this group. If there's any follow-up on cases that you'd like to provide us, we always like to hear how a previous case has been going. If there's any new resources that you're aware of that you want to share with the group. If there's any wins that you've encountered, whether it's quality improvement wins, whether it's motivational interviewing wins, anything like that. This is your time. So if anyone would like to speak up, and for those of you on GoToMeeting, you're welcome to unmute yourself and talk, or you're welcome to chat in the chat box, and Dawn would be able to read that out loud to the group. Ready?
So I have a family that has 3 or 4 kids. I haven't actually met with the mom. I've just kind of heard from the person that referred. I'm meeting with her in 2 weeks. So I just wanted to get some ideas. This family has adopted 4 kids. 2 of them have autism. One of them is a little girl they adopted from Congo. And while she was in Congo, she was living with a foster family that was abusive, and she acquired a traumatic brain injury from that. And so she has long-term and short-term memory loss, a lot of the family is unable to have an MRI done to see the extent of the TBI because she doesn't have any insurance. So financially they can't afford the MRI, but they're above income for her to get like Medicaid and the family's insurance for some reason won't cover her. So I just don't know if there's like any ideas, like compensation for TBI, maybe that would help cover this MRI or what you can think of.
She adopted through church group or a foreign, whoever helped facilitate that adoption. Mm-hmm. I doubt it, but they might have some resources for medical care that way. But I doubt it. Yeah. But I mean.
And Tony, family has commercial insurance?
They do. It's not great, and they're in between insurances right now.
Okay.
Child, the adoption's final.
Yes.
Everything's done, and is she a citizen now, or is she not a citizen yet?
I'm not sure. Yeah.
Legally, she's legal.
There shouldn't be any.
Catholic Community Services, they do a good outreach with adoption and some ideas. I don't know.
You ever worked with Friends of Man?
Yes.
Friends of what?
Man.
Man.
Friends of Man.
That's primary children's
Colorado.
The cost for the MRI or?
Ton, I think I would call their insurance and figure out who their point person is through the insurance, because it doesn't make sense that they won't cover.
Yeah.
And I would start there and figure out, because you can't get any of this other stuff unless you get a denial from that insurance company. So start with the insurance and see what the deal is, because it could be a miscommunication or just lack of information.
And most insurances will talk in their policy that they pick you up, like you have open enrollment, but they will pick you up for a major life event, having a child, adoption. So if adoption's complete, if the rest of the family would be able to get an MRI, it seems strange to me that they couldn't get one for this little girl if she's adopted. The question is, what sort of coverage do they have?
Yeah.
And is it astronomically expensive? Is there a huge deductible they have to hit before anything? Is it like one of those star plans where you have to hit X thousands of dollars out of your pocket before things start to get covered?
But then United Healthcare Children's Foundation will do up to $5,000. Get documentation from the physician. Could help if insurance is only covering like a little bit. Children's Foundation. Our family, gosh. Wow.
Wow. Thanks, everyone.
We'll get into those. Okay.
Thank you.
Okay, we got the Angel. Okay. All right, anyone else?
Yes, mine's sort of similar. We have a 9-year-old kiddo. He was born in Chile. Two kiddos were born out of the country. 2 have been born in the country. I'm not 100% sure what parents, I don't know. They're, I think here, I don't know legally. But he has a ton of issues. He has Angelman syndrome. He has a GI issue. He has a brain issue. I mean, a lot. And so we contacted Mom to, say, hey, have you thought about doing the medically complex children's waiver? And she said, I can't even get Medicaid because I don't have citizenship on him because he was born in Chile. Is there any around that? Is there any, or it's just, so they don't have private insurance. All the other kids are on Medicaid except for this little guy. I don't know if there's any, I guess you can't get Medicaid if you're not a citizen.
For the public entitlement programs, you have to have a legal status. And there's really nothing available through like Medicaid or CHIP.
Okay.
That will pick a kiddo up. I used to work that 20 years ago, and we used to have to go through the family, and kids who were citizens, we would count, and we could, qualify them for benefits, and anyone that was undocumented or didn't have a legal status, and even legal status didn't matter. Like some people, even with, permanent residency sometimes, and depending on certain visa types, we couldn't qualify them for services.
What's the legal status of the parents?
I'm not actually sure. Need to find out. I don't know, but I just know that 2 kids are legal. Aren't. Dad is not working. So
Did you say GI issues?
Yeah, like his stomach, and he has a ton. He's lots of issues, and he needs a lot of services. He's not getting any right now, and he ended up being hospitalized a couple weeks ago. And parents they did like an emergency hospital Medicaid for hospitalization, but he's not getting any other services or help because they can't afford it, and they don't have any insurance for him. I don't know what to do with him.
I wonder if that's one you would call Catholic Social Services also. Because it seemed like they worked with quite a few.
Yeah. That's a good idea.
Refugees, I don't know.
Here's the other question. What sort of care does he need on a regular basis? Does he need to be able to have just ongoing primary care that will just kind of, make sure he's immunized and well child and
and we do that
sort
for
of
them.
thing?
Yeah, and it's good to work with them. But like he needs speech therapy, occupational therapy, lots of therapies mostly.
How old is this little guy?
Is he getting anything through the school?
Yes, he's getting some through the school, but not nearly what he.
But not what he. Okay.
Yeah. So.
We will keep looking. Okay.
What about Scottish Rite requires?
They'll want to make sure to look at maybe Scottish Rites for some speech therapy. These are not going to solve all the issues. And then if the family signs up with Angel Hands as a family, they could potentially help with, since it's a rare disorder, they could help with some of those. Yeah, Angel Hands. But the family has to sign up to be a member, which is not hard to do at all.
Like an online thing they can sign up?
Yeah. And then they have tons of events and such too.
Okay. Awesome.
Do
Tina, I was just when you said Scottish Rite, I was just leaning over to Heather and asking Scottish Rite, but I don't think there's any citizenship requirement with that, correct?
I don't think there is either, but I'm not 100% sure.
Is there an age limit with Scottish Rite? I can't remember.
I think it's up to 12.
We have it in the. I'll look real quick.
Angel Hands Foundation's primary purpose is to assist with medically related expenses, either covered, not covered, or partially. In the portal too. Well, we. So anything else?
1 month to 12 years for Scottish Rites.
Oh, okay, up to 12.
1 month to 12 years.
Oh, good. I thought it was younger. Great.
Thank you.
I've got a general one. I seem to have had a theme lately of egress, and so we were trying to any good online resources or shopping outlets for tracking, like GPS or this family in particular has installed door alarms, but apparently little guy has found a way around those, and he likes to head out to the fields at 3 a.m.
Wow.
Wow. The time it could be.
So sorry.
I know that, and I'll have to email everybody back, but Tina in our office has had to help come up with some very creative ideas for those that get past the door alarms and the Crisco on fences and doorknobs and such to really help. But they did come up with some creative ideas as families, so I'll see if I can forward them on to the whole group.
Ed Whiting at USOR is pretty good. We've referred someone, he may be able to put a tracker in a shoe because this guy's got sensory stuff, so he won't wear a bracelet or a necklace.
And he'll put shoes on.
Yeah. Oh, yeah. He'll throw some shoes on before he goes trucking through the...
I know that they have shoes for older people. Yeah, and I've seen shoes advertised with trackers in them for elderly, you know. Maybe they look into that. Did you say Whitey?
Whiting.
This will be okay.
Anybody else? All right, well, then we'll move into the next part of our meeting and have Colin, come on up. Colin, I just pulled your slides in here, and what we found is that for the GoToMeeting screen share, you can't put it in presenter mode. So this is about as good as it gets, and I apologize about that. But fortunately, it's a nice big screen, so. Okay, great. And I can advance slides, or you can advance slides. Yeah, that's a great question, because I don't see you to put this in here for you. I'll just sit up here. And then the other thing is, this is our mic with the little right up there. You can also hold on to this or attach this to you if you want, and then that audio does get picked up a little bit.
Okay, I'll walk around with it.
Great.
So, hi, all of you that I know. For those of you that I don't, I'm Colin Kingsbury. I'm from Bureau of Children with Special Healthcare Needs in the Autism Systems Development Program, and I am also a co-investigator for the Autism and Developmental Disabilities Monitoring Network at the University of Utah. So the mission of my program is to advance, educate, and empower the lives of individuals affected by autism in Utah. We do that through a few different ways. First is monitoring occurrence, reducing the age of first diagnosis, referral to services, facilitating research, and by providing education and outreach. So this is a quick look at autism stats, prevalence compared to the whole United States. These stats are a little bit old. We've just started the new project, so we'll have some new stats probably in about 2 years. If everything goes well. But what you can kind of see here, the purple is the U.S., so the prevalence rates went up, and then they've kind of started to plateau off. In Utah, we went up really high in 2008, and then we've moved back down. This is really no difference at all. Once you put in the standard deviations, that's the same rate. The reason 2008 is so high is because it was looking at just Salt Lake County, so it wasn't representative. I wish I didn't have to include it because everybody says, oh, look, they're going down. They're not. It's a bad sample. So, but as you can see, they've gone up, and we're really starting to see that plateau. I think we'll probably see that again, but we'll find out. This is the male to female ratio for autism prevalence rates. I've changed this from like the 1 in 58 or whatever to a percentage, and I'll kind of flip back and forth through those as we go through, because some people, 1 in 54 makes no sense. That's me. And the percentages are better. And then for some people, the percentages makes no sense. So, as you can see, though, once again, it's dominated male to female ratio, 4 to 1, 3 to 1. Really kind of depends on the age. There are projections that the CDC is doing that thinks that gap is going to really close down to 2.5 to 1, and maybe 3 to 1. And when that happens, they think the prevalence rates will pop up from 1.5%, maybe all the way up to 3.5%.
Colin, that's because they're not being identified?
That's correct, yeah. So what we're really thinking is there's a big under diagnosis for girls. Yeah. This slide was really hard for me to accept. So what we had seen was the age at first diagnosis for kids with autism when we first started gathering this data was, I believe it was 50 months. So, just over 4 years. That's actually really pretty good. Then it went up. So we had all these efforts out, awareness, Autism Council of Utah, Autism Speaks, billboards, eye contact, MChat. All these efforts went out, and it went up. And I was like, well, that's probably because we're identifying more 8-year-olds. So, of course, it's going to go up. Kids that weren't diagnosed. And then I was looking at these stats, and the prevalence rates for 4-year-olds has gone down. So we're not identifying 4-year-olds earlier. We're identifying them later. The same with 6-year-olds. And so then those 8-year-olds are going up. So we are really missing the young kids, which is a bummer.
Are they still using the MChat as the tool when they're older?
So
for the 4 and 8-year-olds, or is that strictly for the 18 and 24 months screening?
Yeah, so the MChat's good from 16 to 30 months, and it's invalid after that.
Oh, okay.
Yeah.
This is nationally?
This is just in Utah.
This is in Utah.
Yeah.
So we're missing young kids in Utah.
Yeah.
So, Colin, why then that spike at 8? Is it just they're in school and things just aren't meshing, and so then... we're putting 2 and 2 together and saying we finally... So kids that might not be your typical presentation are skating through just a little bit longer?
They might be your typical presentation.
They might be, okay.
Yeah. It kind of depending on the year. I don't have a slide for this in here, but about 20% of kids in Utah are identified solely through the school districts. They're doing all the testing. And you know all about this. They're doing the ADOS, they're doing the GARS, they're doing the screenings, they know, and they have just been missed. And it is really based on socioeconomic status. So kids who are higher SES, they're not being missed. Kids lower SES are the ones who are being missed.
Is MChat the only screening tool for the younger children? valid, or are there other screening tools out there too?
There's a lot, actually. MChat's just kind of considered the gold standard. It's like 20 questions, so it's really easy. There's one that some other folks in the CDC group are working on that's only 16. But it really, the reliability fluctuates a lot on these. And I'm not supposed to tell anybody this. If you dig into the research, the MChat reliability, it might not be that good either. So, I think there's a paper that just came out showing that it has a lot of false positives. And then there's one coming out showing that it has a lot of false negatives.
What is better, right? I mean, positive and do further investigation and then conclusion versus missing somebody.
I think the false I don't really have a problem with false positives, because if the kid needs help, you get them the help, and if they're higher functioning, they'll benefit more from that. But like I said, there is another paper showing that it might miss a lot of kids too. So it just might not be that great.
Are these numbers like when they've actually got the diagnosis from a doctor or from a school, or when are you counting?
Yes, so these numbers right here are actual diagnosis. So it's the autism diagnosis, or PDD-NOS. If Marilyn was still here, she'd laugh. That's an inside joke. So yeah, an autism diagnosis or the autism classification at school.
Through an ADOS, or does it matter?
I don't think the schools have to do an ADOS to do. Yeah, most of these kids would not have had one.
Because I've seen a lot of families that they don't really care to get the diagnosis because they feel like, well, the school already told us we're getting the services through the school, so why do we actually need the diagnosis? So I think that could kind of blur the...
If they want state services, they need the formal diagnosis.
Yeah.
And they want insurance coverage on
But
that.
I mean, that's the mindset that they come into our program, having that mindset.
Because
that's what's, sorry, Eric, I didn't mean to cut you
No,
off.
please.
That's what's happening when they end up calling us when they're starting to have the issues with the school. They don't realize that what the school's given them is only for educational benefit. It's not a medical diagnosis, and that's where the big gap is.
Yeah, so I think that's kind of where the 8-year,
So back to monitoring occurrence. So approximately 1/3 of children aren't identified actually until after the age of 8. So it's even later and later as we're pushing higher and higher for that diagnosis. As I mentioned before, delayed identification may be related to severity. If they're higher functioning, it might be missed, or the parents might not actually think it's that much of an issue. Race and ethnicity. We see a big drop in prevalence among Hispanic populations and African Americans and Pacific Islanders. For nationwide, that's true with just every ethnicity other than Caucasian. So that holds true throughout the CDC's study area. And then socioeconomic status, that is also something that's holds true throughout all of them. URAD and Adam did a study looking at prevalence rates. And like I said, with the 1/3 not identified until after the age 8, they found that the prevalence rates for 16-year-olds is 1 in 50, so 2% of the population.
Colin, when you talk about severity, does that mean intellectual disability, yes, no, or is it all aspects?
I think it's all over the place. So 70% of kids in Utah that are on the spectrum have an IQ of average or above. So we should break that down to see. That's a good question.
So I think that, particularly when you're thinking about identifying at a young age, intellectual disability is probably the thing that's going to bring them to attention more than the social thing. So that's why I wonder.
That's a great question. And I also wonder, because I get a lot of calls from families for kids who have severe intellectual disability who get diagnosed with autism later on and were missed in the clinic. So very good question. All right, so for reducing that age at first diagnosis, like I mentioned, we're at 52 months. I'm really looking forward to getting some new stats on this so that we'll know where we're at and we can get a better baseline. Autism can be diagnosed as early as 18 months. This is an older stat, but it's one that I think about frequently and should come into play later today. Only 44% of the kids in our database that were diagnosed with autism have record of having an MCHAT screener. It's a dirty stat in that doesn't necessarily mean they didn't have an MCHAT. It might have disappeared. It might have been on paper. It might have been lost. But it's just not documented in there. And then we can actually go to the next slide there. We are taking 2 initiatives out, all through funding through the Autism Council of Utah. We're just trying to get those screeners out and available to folks who don't have a primary care physician. One is Help Me Grow will offer the MCHAT coming in the fall. So if a mom calls in and has an 18 or 24-month-old, they will send them an MCHAT on their phone. They can fill it out, and then it gives them a message that Help Me Grow will be in contact with them to discuss the results. And they do the follow-up portion of the MCHAT at that point.
Colin, is that for the whole state?
Uh-huh.
Okay, cool.
Yeah. And then the Autism Spectrum Disorder Clinic is going to do a pilot, really hoping with Salt Lake County WIC offices. It just depends on if they want to do it or if we have to move it up to Davis or Utah County. But they will have a WIC office, give the parents a link to do the MCHAT at their 18 and 24-month-old check-ins. And then it's a great benefit for parents because if the child screens at risk, the ASDC will do their evaluation for free. As part of this pilot.
When is that supposed to start?
That one I do not know. I'm hoping in the fall, but since I'm a government agency and WIC's a government agency, sometimes these things take a while. This next slide here is it's a screenshot of the MCHAT that'll be on the phone. So this will be a person's phone. And as you can see, they can just click yes or no. So it's really easy for the parent to do. I like this way because it allows the mom to do it when she can sit down and think about it. Does your child pretend play or make believe? In the doctor's office, you might just say yes. Yeah, he does that. But if you sit down and think about it, you could be like, well, I don't know. Does he really? No. So hopefully with them having the time to sit down, think about it, and do it at home, maybe we won't have as many false positives or negatives. It's kind
Colin, with it on the phone, does it come as a link, or do families have to log into a site to be able to
comes as a link.
Awesome.
Yeah.
So it's pretty easy then.
It's super easy.
Awesome.
Yeah. Okay. That was the goal, to make it as easy as possible. Yeah. Yeah, that's just further example of the nose. And then once they complete it, this next slide will show you've completed it. We'll be in contact with you. And if you need to contact us before then, go ahead. All right, so these are some more prevalent stats. I mentioned this earlier. These are the socioeconomic statuses. So the efforts to get, this is nationwide, to get autism screeners and diagnoses into lower into different race and ethnicities has worked. I mean, they're going up, but that gap does still exist. We talked about this earlier, so we can go ahead and skip this one. This data is from Spark, which is a different organization. This is looking at mental health, and I believe it's all self-reported. But it's for adults, so you can kind of see later down the line. I know you guys don't work with adults as much. So this is just them reporting anxiety and bipolar disorder and depression. And you can see like these rates are really high compared to the general population. So people with autism have a lot of co-occurring issues going on that affects what they're doing in their lives. This one is for education. I have some Utah-specific data on this as well. As you can see, most of them make under $21,000 a year, which is pretty rough to take care of your household at that point. And then a lot of them enter college but don't actually graduate, so the graduation rates are really low. I'll get into why that's somewhat surprising in just a second, and then somewhat not. Let's go ahead and skip that one. This one's about gender and sexuality. I don't quite know what to make of this one yet. So 60% heterosexual, and then 10% asexual. A lot of I don't know in different responses. I'll be interested to see how this flushes out later down the line, to see if this is like a moment in time or if, you know, I just don't know what to make of this one quite yet, because it's just one point.
Is this through Spark?
Yes. This is characteristics of autism here in Utah. So this is our data. IQ in the normal range or above, it's right there. And this is 90, an IQ of 90 or above. Completing a post-secondary education, so your average person who enrolls at the University of Utah graduates in 6 years. 68% of people do that. That's only true for 41% of folks with autism. Unemployed and underemployed, this one is a really heavily estimated stat, but only 3% of the population right now is considered unemployed, and that can range from 50 to 80% for folks with autism, even though they have this IQ in the normal range. So looking at bipolar and anxiety disorder, and thanks to Gina, this was her idea to have these stats. In the URAD data specifically, we found that 20% of people with that autism diagnosis had bipolar disorder, an ICD-9 or 10 code for that. And then with anxiety, it's up to 33%. These are younger kids. I believe they're 8-year-olds, so as they age, those numbers will probably come into alignment with that Spark data, which is a little bit higher than this even. The suicide data, a paper recently came out by Dr. Ann Kirby looking at suicide data, and you can see autism, a higher rate of suicide. What is most concerning about that is that it's gone up sharply over the last few years, and that it is females who have autism spectrum disorder that are committing suicide, which is generally the opposite of your general population. When you're looking at females who might attempt suicide, more often they're much less likely to succeed. In autism, it's just the opposite.
Can I hurry and comment on why I asked for that data?
Yes.
Because I know you're running out of time. We're finding in the state that those that have a child or individual family member that has an intellectual disability, including autism, if they're experiencing mental health issues, it is almost impossible to get someone, especially on Medicaid, to see these individuals because they keep saying, oh, it's just their developmental disability. So we just came out with a white paper recently with a few authors that I will share here that's now gone up to the policy level because we're not a favorite entity right now, but we're saying it is a breach of contract for Medicaid providers not to look into helping, and especially with the statistics of how many have a dual diagnosis, and it's just not right that we can't find adequate help for these children and adults. So thank you, Colin.
Oh, thank you. These are some resources. So, of course, the Medical Home Portal. This is a short link to my program website. There's a a young guy, a college student named Jake Fink, who's starting this life with MyPath. It's still in kind of the beta stages, but it's supposed to guide parents through what they need to do. So once you've had your diagnosis, okay, it's time to get linked up with ABA. So it's like I call it like Candyland. So you're going along that path of where you need to go. And then, of course, Autism Council of Utah, who will have a new website coming April 30th. So get ready for that. It'll be much better. Process for a diagnosis. Those wait lists are still long. Some people have wait lists, some people don't. So it really depends on the provider you call. If they're on Medicaid, they need to have an ADOS done. I know that UDAC, I've heard that they have an exemption with Medicaid, that if a child goes to UDAC and has a multidisciplinary evaluation, Medicaid will still cover ABA for them. I think that is just UDAC, and I always recommend having the ADOS done, even though my personal belief is that it's probably overkill for a lot of these kids. But I always recommend that. SB 095 passed. So there were some good things that happened in the legislature this year. It popped off the age limit for insurance coverage, so older kids can have ABA cover, not just up to 9 years old. And it also prohibits certain health benefits from limiting hours of treatment, so that's good. We'll see how the insurance companies handle this. I was working with a dad the other day who's told me that PHP told him that they didn't cover autism therapy. So, it is still, as we talk about all the time, insurance companies are horrendous to deal with.
Colin, is that effective immediately, or does that start with the state fiscal year in July?
I believe it starts with the state fiscal year, yeah. Here's some other fun stats from URAD. So we have a paper looking at labor induction and augmentation. There was a doctor at Intermountain whose patients were saying, we don't want to have our labor inducted or an augmentation done, even though it's dangerous for us not to because we've heard it causes autism. So she did a study and found that there is no associated risk with that. So that's good. Suicide and autism, we touched on that earlier. And then inflammation during pregnancy. There's a URAD paper that's coming out showing that inflammation during the later stages of the first trimester and the early stages of the second trimester lead to increased risks for autism. And then that's all I have. So if there's any questions, I'll be happy to answer them.
I, on the next slide, just put in a couple of links that will probably, you go to your website and they're up right there. But these are a couple of lists that Colin keeps up to date.
Yes.
On autism evaluation providers and ABA providers.
Oh, they always they yell at me if they're not up to date. Okay, providers do. So.
This is good. Yeah. How do we get providers to yell at us?
Colin, I had a question. Isn't there a rule that is out that requires when a child gets diagnosed with autism that it gets reported at a state level, like a registry for that?
That's interesting. So URAD, so autism is a reportable health condition in Utah. The statutes are kind of weird. It says a medical provider has to report it within 30 days. Although it's not followed like that. So URAD sends out a data request to all the major healthcare providers and asks for children diagnosed with autism or related conditions every 2 years. And then the healthcare providers send the data into URAD. And that's how we get all of those statistics.
Okay. Just with the fact that we're doing some diagnosing through our clinics, I just make sure that we're compliant with said statute, rule, regulation, whatever it is.
Yeah, I'll let you know. I always have to be the hammer on that one. But it ends with me, so don't worry. No one else cares.
So
just to understand that better, so you send a request to, you said the major healthcare providers, like Intermountain University?
Intermountain, University of Utah Medical Billing, Valley Behavioral Health, Eric.
So private practice groups would not get that request.
In the past, we haven't done private. I mean, they're still covered, so they would still have to report. We just never have because we've never thought it was worth it. Like, we didn't think the catchment was large enough.
Yeah, and I imagine there's not a lot of kids being diagnosed just in their pediatrician's office. I mean, most of them would get assessed somewhere else that you would likely get information from, or
right? Yeah.
And they submit names so you don't double count. And
that's exactly right. We get child's name, date of birth, mother's name. And that really is to avoid the double counting. Yeah.
You're asking for new diagnoses since the last report.
That's correct. Yeah.
So just to clarify, so the practice that's reporting keeps those stats for 2 years and then reports in bulk, or you report as you go?
No. So they just keep it in their EMR. So like the University of Utah just has that in their EMR, and then every 2 years we ask them to give us 1 year of data. So, because we count every 2 years instead of every year. So in 2019, we say, hey, give us the kids diagnosed in 2018. So from January 1st, 2018 to December 31st, 2018. And then we get that. And, it's funny because the double counting is a big issue because a lot of these kids will be seen at university and at Valley or at Intermountain and at Davis Behavioral Health. There's a lot of mingling, which it's kind of weird because you'd think that we have this diagnostic wait list. Why are some of these kids getting evaluated twice? But it does happen. Hopefully not as much as it used to.
Colin, I have a couple of questions. One, do you have any information on the average time frame it's taking families to get their child diagnosed with autism in the state of Utah?
Really, really depends on the provider and their insurance. So Pingree is like a month out, and you go in and it's 1 day. Like you're there for like a couple hours. ASDC, Natalie the other day told me they were 3 weeks out. So it really, really depends on the provider.
The other question is, we were talking about previously, you showed us the statistics on the kids with autism that enter college, but how poor the graduation rate is. Have you seen anything at the university levels in the state of Utah where they're forming some type of support group or anything like that to help these kids graduate?
Yeah, I think all the major universities have something like that. The best one is probably at Utah Valley with the Melissa Nelson Center, where they can go and they have the Passages program, which helps them. University of Utah has that on some smaller levels, and they even have employment coaches there. Val Dastu working at the University of Utah helps people with autism that are enrolled. So that is something we're starting to see in it. A lot of them are doing a really good job. Those programs are growing.
It's good to hear.
Kind of a comment along Heather's line. I'm thinking of the population that I mostly see in my counties, and most of them aren't going to be going to the University of Utah just because of cost. What about trade schools or tech schools? Are we tracking any of those? Because I feel like sometimes that might be a better route for some of these kids. Their interest could be in that area. Has that been tracked?
I haven't heard of any doing that. I mean, I would love to talk to them about it.
Maybe Utah Valley might have something there too, but I'm just thinking, I think, with the welding programs or certain specialties that might appeal to certain individuals, that might be a more successful.
Yeah, I absolutely agree with you. I think that would be a great place for them to start. Unfortunately, I think the rivalries with the universities here is so intense that, I don't know if they would ever share their programs and how what's effective in their program for those kids. But that's a great idea. Actually, I think maybe I'll talk to Lori Bowen at UVU about that and see if they would be interested. That's a really
But like community college?
I don't have any stuff from them. Yeah, any data, or I don't know anything about that. I think with the universities, these things happen because it's an autism researcher at that university that then wants to spearhead the program. Like at the University of Utah with a lot of their employment programs, that was spearheaded by Bill McMahon saying we need to help people with this. So that was kind of his deal. And then, so, you need that researcher to say we need to do this and have some clout and push and get it done.
Okay, Colin, thank you so much.
Thank you.
Okay, so we're going to switch gears in just a second. Ron, do you want to talk quickly and set the stage for us?
Sure.
Okay.
So one of the projects that I'm involved in right now is with the University of Utah Peds Tele-Echo. And we offer QI support for people who are participating in that. And I know I see Jan on the calls, and Amy Spears is on often also. She's at Holiday Pediatrics, and she reached out and said, I want help as a care manager to improve our clinic process of the screening, having them referred to me for the follow-up questions. And it really just, once she started thinking about it, realized I don't know who my patient population is with autism. Sometimes she doesn't find out about them until a mom calls because they're bullied at school and stuff. So I've been working with her a little bit, and thought it would be good to kind of do a group process mapping of what's happening in different clinics and identify gaps and share thoughts.
Yeah. And I thought it was really interesting in Colin's slides that you talked about that slightly dirty stat. It's the 44%. Yeah. So this is kind of the point Colin made, is that I'm not sure about this stat because maybe the paper trail disappeared somehow. And this is, I think, a little bit of what Dawn is realizing, is that there isn't this perfect process already just set. There's a positive screen. It's in the EMR. The care coordinator is aware of it. Things move correctly past that. And so that's kind of what we're looking to talk about in our small group exercise. So with that said, so we don't have huge numbers, which is great. That means we'll have a little bit more time and a little bit more space in our group. So I'm going to lead a group in here. And we'll ask for the rest to go in the other room, and there's 2 areas set up in there. I know that we kind of have Eric's group overall that could probably just be one. If you guys want to stay put, or if you want to move and mass, either way is fine. Then for the rest of you, if you can kind of, so I know we have a few Wasatch Peds folks, I know we have a few folks, so if you guys want to stay together. Anywhere else that makes sense, that's great. And then if you're kind of an individual, then if you want to pick kind of a sticky note color that's a little bit more unique, have colors where we have a lot, so those would be for the larger groups. And that's just so we can see trends, and that's so that we can help point out to you what we're hearing in this, including with the meeting one we'll work with. Okay, so I'm going to ask for your help to try and do this orderly.
I see you guys go.
Should we stay put?
And everybody else
Okay.
can move again.
Okay. All right. That works fine.
Sorry.
I'm going to see you, Chuck.
Quiet space. So hopefully you guys can hear me and screen. Here are the questions for our go-to-meeting folks. And get some food on your way. If you guys want to come up so you can see the questions a little bit better, maybe that would be good. Oh, we're going to have people take their name tags. That's all right.
Colin?
It's like the spring allergies are coming out or something. Or no, just
On the sticky notes and plunk them up here for each question. Okay.
Well, let me tell you, I referred my own sister. She did. She did. Yes.
how you doing?
Type it in the chat. What happened? Has a positive screen. And maybe I'll use
You gonna stand up and present?
No, I'm going to gather sticky notes and pitching them up here on our.
Okay.
Presentation. Autism Council. Cheryl has this whole slide picture of all the time.
Okay, guys, let's look at that first question there. And given that we're not primary care, this is kind of a different realm for us. So let's kind of think about that. What happens when a patient has a positive screen for autism? Right, Teresa?
They would refer, but I don't know that they do.
Okay.
In my area, at least.
What do we think? So let's put this down. What everybody thinks. I'll stick them on the board. This is like we've had an MChat, right? So an MChat kid has a positive screen for autism, not diagnosed yet.
Oh, it's not there.
So screen. So the screen is one. So they have like an MChat. So what happens when they have a positive screen?
Take that one.
have a positive MChat. The providers let you know.
Sorry about that.
So are we saying like when they get referred to us, what happens?
Well, I'm assuming that's when they're coming into the system. So,
Yeah, because that's. I mean,
so it's kind
how are
of,
we gonna
it's
hear
weird for us because we're not like a primary care practice that we're saying, oh, you're 18 to 30 months, let's administer an MChat for you. It's a little bit different for us. Are we getting referrals in where it's just simply been the pediatrician's office or the family practice, or Help Me Grow has said to the kid, where the family, oh, you screen positive on the MChat. Are we getting those?
We get them from EI,
comes in that way.
but they don't do MChat. They just usually kind of say, hey, this kid's looking like it's I would like to see.
We have Central Cove.
Ours does not.
Okay. So the district has a preschool that will do an MChat with them.
I would love to talk to you. I would love to talk to you about this because I used to work at EI.
Question and
nobody in our area is doing it.
The district has a developmental preschool called Central Cove, the school district, UNA school district. And so I'm not sure what their method is as far as who gets one, but from time to time, like every other kid that's referred from there has one.
So on the next one, are we notified of positive screens? Well, folks are reaching out to us. So a lot of question 1 and question 2 are kind of the same. So how are we notified of positive screens, and how? Well, they're referring back.
The positive screen is a referral in my day-to-day.
And so I'm just going to generically write in here that it comes in as a referral to us.
Yeah.
That they think the kid needs actual testing.
Mm-hmm.
Spell that. Is that a safe assumption for all of our local health departments as well as Wasatch Front? That there's been a positive screen, want to get it in, they'll send us a referral and say, we think this kid needs testing. That's why we're not getting tons of other developmental issues coming through our clinics, is because it's autism heavy focus for diagnosis. Okay, where do we find autism screening results? Are we getting those in that somebody says, okay, we're sending you over a copy of the MChat, this is why we're concerned, or is it just voiced concerns?
It's either voiced or just written on the referral.
Or on the
How about referrals we're getting in from providers? Are they just basically saying,
yes,
autism or whatever?
You really choose, like they don't want to sometimes say.
Yeah, they don't want to. And they typically don't say failed MChat, but we do get those.
So we're not getting the screening result, we're just getting that direct referral.
Yep.
Okay, because I was going to say, just my experience, anecdotally, I would say I don't ever recall getting a copy of a screener and saying,
No.
oh, we were worried about this. So,
In your EMR?
and we wouldn't really be able to go back necessarily. I mean, I guess we could ask for it if a screener had been done.
Mhm.
Are we asking if a screener's been done?
Not necessarily,
I
no.
think we should.
But on our.
What do you guys think? Is that a valid thing? Because
And if they're that
here's the other
age, why
piece, too.
couldn't we?
How often are we getting kids coming to the clinics that are, it's way out in the field and we really don't have? They really aren't spectrum kids.
I did a chart.
Are we getting a lot of just weird referrals coming in where we're saying a kid totally doesn't have
So
autism?
it's not in like the
Are we
field or anything. but
getting any of those?
um,
My gut says no, but what do you guys think?
10 to 15% maybe.
Do you think?
Maybe.
That high?
Probably not.
Melinda, I'm just going to go back up to you. I mean, not
All right.
But I think that Gwen has a great idea because if it's a referral for autism, we can put like a little drop-down box underneath that if autism is the main concern.
And if our medical providers, sorry to interrupt, if our medical providers have our referral sheet and it says on there, did you do an MChat? Have you, that maybe
Yeah.
they'll start thinking.
Because our rural areas really lack.
Yeah, I've not ever had a provider when I worked at EI say, hey, we did the MChat and we've got this really high kid we're concerned about. Maybe. I think just having that out there is exposure. I think help me grow. I think that's a good thing. Excited about.
So if we were really encouraging the providers in the community
Yeah.
to actually do this.
And
Okay.
especially in the rural areas.
See that,
Okay.
Kelsey?
Mm-hmm.
All right, so I just spoke that we should request MChat. Okay. What do we do after we get this information? Well, generally, what are we doing?
Will then be
Looking for resources.
Scheduling, finding resources, making sure they know of our partners.
Write some of these things down and I'll stick them up there. So all of that sort of stuff that we're kind of stopgap. Okay, it's going to be 4 months until we can get you in for an evaluation. In the interim, you can do this. We're other providers for testing. We're not the only gig in town. Well, yes, we are the only gig in most towns.
Yep.
But if folks can travel, referring them to other places. Okay. But generally, with our rural areas, we're referring. It's not just a couple towns away. It's generally saying go to the Wasatch Front, correct?
And stuff and how I'm just curious how.
Well, help if I figure out which is the sticky side.
Share that will help Amy.
Okay.
QI.
Anything else we're writing up? Less a year still in the throes of writing right now.
Melinda, what do you think could be better? Do you feel like one of those students should be referred to you, or?
Because here's the question: who asks the follow-up questions? I know we do a medical screener, but we try to get stuff. Some. When did your child walk? Were they NICU grad? A whole bunch of things like that. What sort of follow-up questions are we doing at that intake phase where we're trying to determine if the kid's an appropriate fit to come to our clinic?
Do you give them
What sort of follow-up questions?
That are useful.
Doing that. What do you guys do?
24 to 30.
I usually ask if they have friends and if they mind that they don't have friends. Because usually that's, moms say they don't have any friends. Do they care? No, they don't usually notice they don't have friends.
So some of those kind of typical manifestation type questions.
I don't know if I'm
Several
understanding the
behavior, likes, routines.
Yeah.
See, I actually think I should have been referred as a kid. Just some of those texture issues I have, fussy about certain
I'm
things.
apparently not understanding the question.
Yeah, I don't think I'm
Sorry.
understanding
So
the
we're
question.
looking at who asks the follow-up questions here. So what do we do after we get the information, and what sort of follow-up? Now,
Does that mean more like what we follow up for medical?
Well, if you're looking
Care?
at, let's say, a
Like, did you
traditional
go?
pediatrician's office,
Yeah.
if this were kids in for, 24-month well child check, and what are all of the follow-up questions that are asked to really kind of ascertain I think what you're looking at is if an MChat was administered, did you do the RF to
those types of questions.
check it on those questions? For us, this is nuanced. This is different because we are just getting that referral in. So I'm tweaking it to our own purposes.
Okay, I didn't understand
For this to basically say,
Write it how you want it.
So this is to decide
if they
what
need
we're
to.
referring for testing and like. Because I just wrote like SSI and DSPD, because if I got a kiddo going for autism, I'm looking for intellectual delay and other things and seeing if they have DSPD. So that's why I wrote that. But are you saying more like, hey, you have sensory issues, we got to get you in with OT?
Here's what I'm saying is, not all kids are a good fit for our clinic.
Yeah.
So what I'm saying is, what sort of questions are being asked that helps us determine if this kid's going to be good?
Oh, okay.
So it's kind of tweaked. It's kind of tweaked to our own purposes.
Can you travel?
Specific follow-up questions for.
And I think calls are coming to you guys. I mean, our care coordinators are talking to the family about that. How often do you turn somebody away and say, that we're not coming out as a good fit for you?
Never. Never. I mean, at least we're talking with them and referring to, trying to give them some kind of ideas.
Yeah. See. Okay. These are the type, and for this one, maybe these are the types of questions that we're asking.
Great.
I don't know if that's helpful.
I understand the distinction. Just so you guys understand, I think what Ann had found in Amy's case is that there might not be someone assigned follow up.
So MChat happened, we got the results, now what?
Yeah.
See, that's helpful for us to know as we talk with some of these offices that are referring kids over.
And
Okay, what really did you do that truly makes you think we should see this kid?
Maybe they did, but no one's
Okay, so the next question, I don't know how pertinent that is, but what works well? I mean, for us right now, would you say that getting some of those questionnaires in and some of those things in from the parents, getting additional information like on that medical questionnaire, is that helpful? That help us to kind of pinpoint a little bit or have a little more specificity with what families' needs are?
Well, I feel like the families I get are mostly from 7 to 10 behavior. It's that age 7 to 10. So if we have a younger MChat, then we can refer to early intervention. We can refer to early Head Start. They're still young enough that they can still get a little bit more hands-on help, because once they're older than 5, their only help is going to be the school unless they get that diagnosis. Then maybe they can get kids on the move and some ABA therapy. But, EI would still help, or early Head Start would still help if they're under that age.
Out on the phone so they can do that while they're at home.
So we're basically saying then, so what works well, so scheduling open line of communication, community type stuff, okay?
Questionnaires like that when you know a patient is coming in.
Certainly we know early diagnosis, so I mean we'd like to see that happen.
So
Kelsey, you have that pensive look. Are you ready to write something down? Okay.
So when I have and I maybe again, since apparently my brain is well, so what works well, one of the main things that I do with families now is the education piece. There's so much anxiety on these families' behalf. I mean, that they're so concerned that their kid has a possible autism. And what I've found that immediately can make a big difference, like this family in Ogden that just was so concerned about their one child who has Down syndrome, that their older child, I was just like, this kid has autism, when I'm at the house. So we, talked and everything and got to this point, and they were like, yeah, we're really concerned about him. We've been so concerned about this one. So when we started talking about possible autism spectrum during that conversation, there's a lot of anxiety that goes with that. So one of the main things I do is I get on the MedHome portal with these families that are, intellectually, typically parents or whatever, I get on the MedHome portal and I go over the Autism Diagnostic module, because education is power. Education relieves unknown fears, all of those kind of things. So I think the education piece is huge with this family. So as a care coordinator, I think it's the MedHome. I use that a ton. It's that education piece. It's taking time with that family. It's letting them take some time to absorb things and then following up with them and continuing to provide education.
Saying the exact same thing, like a home visit.
Yes.
If it's a family that's really like struggling and I'm not connecting well over the phone, I go and do a home visit, which for me, my area is like 17,000 square miles.
Yeah. Oh, I thought it was bigger than that.
That's it. Or Linda. That's all you got. I save it for really special occasions. But just Friday I went to one in Delta, and after, because this mom had called me multiple times, and it just wasn't going well. So I went to their home, had an aunt come to verify information, and when I left, it felt so much better.
It does. You can feel it. It's awesome.
Yeah, I had that yesterday. And this mom, I was trying to talk to her on the phone. I could not understand anything she was saying. And when I went to her house, she has COPD, so she was having a hard time talking and breathing, but they don't have transportation. So being there, they were so appreciative of that. But then I was able to communicate better with her and understand their situation.
Okay, so let me ask you this one, because I think we've kind of we already discussed this piece. What do we think is missing? I really think it's important to encourage that early screening in the community.
So the question is, our role in the care coordination piece where we are, to try to encourage those providers to make sure that they are implementing MChat at those recommended.
Yeah, well, I was just thinking that thing that they're talking about. I'm like, this isn't needed in Salt Lake. This is needed in rural Utah.
Okay, well, exactly. I got a note. I was going to bring it up in our meeting later today, but I really think we have a role in the local health departments to be able to be a resource.
Because it's something that you guys can.
Family comes into WIC to verify whether this type of screening is good.
We ask on ours if they're on WIC. We're referring to WIC, and I think they refer to us. If they had that MChat for those kiddos.
You have the ability to do that phone MChat. Colin, the phone MChat, would we have access to that? Would our staff here have ability to
the Help Me Grow version?
Is that phone only Help Me Grow?
That was their program, but
the WIC thing, could we do that in rural Utah?
With her question.
you can
Help Me Grow would be available anywhere in the state, right?
Right, but that WIC in our office will come to WIC in rural Utah. They come to the WIC clinic.
That's one thing they will come to.
And that is a place that we can, we can talk about so many things. That would just be a perfect end for rural
in person. And I just don't see our rural families, quite frankly, if they got the link, and no matter how easy it is, and tell me what you think, but they're not going to do it on their own. But if they're in person, and they that's one thing they will all go to is WIC.
Even if it's a paper copy and they collect it, they might not be thinking about it the way that you really wanted them to. But maybe we can follow up and go out later or something. But
Colin, is the thought that a lot of times when folks are right in the office or whatever, they're getting socially desirable answers? Oh, of course my kid does that. Oh, yes, he absolutely does that, rather than really thinking it through. And you kind of alluded to better thought process when you're doing it on your own.
Yeah, but there's also Salt Lake County WIC doesn't want to administer the MChat.
Yeah, I don't know that our people would want to administer the MChat, but if we could do the link thing too, that would.
But see, my thought is this: if you're there in the office for the most part, or could WIC refer back over to you? It's inter-office referral.
And then you do the link.
Over to WIC, and WIC says, if WIC just asks one really quick question about, have you had this screening done, kids between 18 to 30 months, maybe they did have it already. And, parents sometimes aren't great historians. Could WIC refer back to you to at least be that link to get the paper copy,
So
the
should I
phone
wrap
copy,
up in 5 minutes?
whatever.
Yeah.
Does that seem reasonable to pair with everybody? My WIC people are great. They're such an asset.
And think so too.
I think
Kelsey,
it's easy for
you
us.
guys down there are all.
I do WIC. Like,
Yeah.
that's what I'm saying. I do WIC as well.
Yeah.
Like,
We're constantly,
So sure.
yeah.
That seems like a real logical
communicating.
fit to me.
Well, Eric,
What if there was like a laptop or
download it on an
iPad.
like an iPad or something when
So
they were
we
checking in, and the receptionist just says, "Will you quickly just?"
we have that for, we're doing Mom's Mental Health Matters with the youth.
Edinburgh
And
screening
in
on
Central
top.
Utah, we hand them the tablet and they go through their screening. Mom's Mental Health Matters. It has been fabulous. Like, it has worked so well to get our
Want to
people
throw one more
connected.
piece in there if mom's already filling out mom's mental health.
Well, they wouldn't necessarily do.
It would only be the 18 to 30 months.
It's only going to be on those people that have
A child within that.
Colin, you were starting to say something. So
let's meet with Chris. See. Ferner.
Okay.
I'll meet with you. Know, you, me, and him. We can sit down and discuss.
Now let's talk about how we can make it work. At least in our four health districts where we have care coordination.
What he told me was if you can get Salt Lake to do it, you can get any of them to do it. The reason ASDC wanted to do Salt Lake was to create the pipeline to their location so that they can do the evaluation. But you're a traveling clinic,
I know
so
Central would do it. I'm saying right now.
And I get to travel to the rural health departments. That's a lot of what I'm doing right now. So I'd like to be like a part of that meeting if I could come. This Chris Ferner.
yeah, that sounds great.
I kind of have a tiny glimpse of what you guys deal with.
That's a tough one. This question.
And what can we add or change to improve the steps after positive screening?
Most of my referrals are like
All right.
determine autism versus ADHD.
They are.
Just because it's noisy and everything.
Really, for us,
Wrap up. Any other questions?
more behavioral or more like psychology access to be able to do more actual testing.
So
I've been racking my brain about this. The pediatrician, I don't know if it's that they don't want to, because there's like a grieving process when pediatrician has to tell parents, hey, your kid's got a behavioral or mental health concern. So he's just going to refer them out, but he doesn't want to refer them to mental health because I think there's some stigma there. That's my theory anyways, is that he doesn't want to be the bearer of bad news. He wants to maintain this therapeutic relationship with them.
Articulate that in 10 words and stick it on a
10 words or less?
Put it on a sticky. Cliff's Notes version.
As a court,
He doesn't want to be a bad guy.
What's going to happen?
What was that?
I was agreeing with Leslie that you don't know what's going to happen after that because it's out of your hands. So yeah, letting go of it, I think is hard.
Thank you.
Our big push as care
We're going to be talking about that today, by the
coordinators.
way. So.
Oh, good. As care coordinators, again, I think it's education. I think it's educating and bringing the parent resources and helping see where that family learns best. Are they visual learners? Do they need something tangible in front of them, like the 100-day toolkit from Autism Speaks? Do they need meetings like home visits? Just the education piece to see what is out there in the community in the rural areas, what's online, things that they can do. So I think that's as our role as care coordinators, it's to really help that family understand the process and to get them resources.
Well, one of the other things too is we always, when families come in, I know that I always try to give them, oh, hi, my doctor said I should call you guys to come in and get tested for autism. I'm very forthright with saying it's going to take you a while to get in the first place, and then it's going to be a several month process.
Yep.
So I also tell families too, get on other waiting lists for other places that can do it.
Absolutely.
And whoever can get you in first,
Yep.
the better.
And resources in the meantime, so they don't feel like they're like, what can I do now? I need to do something today for my kid. That's our job.
I had a family yesterday that the mom was kind of reluctant into getting her child into early intervention.
Mm-hmm.
But he has speech delay and probably autism. And I just said, well, he qualifies for early intervention. Or if he qualifies, because he's almost 3, he's 2, just over 2 years old. I said, why not just, if he qualifies for it, why not get the resources now that you can? It's free, just do it. And if he doesn't qualify, then great, but just go for it. And so she was like, okay, I'll do it.
Yeah, there are various, some stopgap measures while we wait to really get it.
Mm-hmm. Give them the opportunity to blossom out of having early intervention.
Mm-hmm. Yeah.
Absolutely.
Get you to where you don't qualify anymore.
Mm-hmm. Thanks, you guys. Thank you.
Kind of a different take on it.
Yeah.
And once I start looking at it, I'm like, oh, we're kind of a little bit of a 30-degree angle off of it over there. So. Okay.
Great, and that's why we wanted to together for that very reason.
Yeah, we would have totally screwed everything up if we'd split out. It wouldn't have worked.
They're like the Leatherman of clinics.
You what? That's all right. Throw me down.
Just throw elbows in.
Okay, so as folks are coming back in, I'll just take the last couple of minutes to let you know what we hope you'll now do as you leave this meeting and in the next month or so before our next meeting. So what we're going to do right after this is go back with these sticky notes and try and collate them and see what the themes are and identify them by the folks who report these things. So the groups or individuals. And then we'll summarize those by group. So we'll summarize those by group and we'll send them to you as a group. So the group I just worked with Eric's team, I will summarize this and send them to all of you and you can look them over in the next couple of days. So hopefully by Friday we'd like to have many responses back and I'm not sure from you by then, I assume. And we'll do the same with our other groups. We'll send them that, ask you to look them over, make sure that we got what you were trying to say, and then they will be part of our resources of the month. We'll go out probably Friday or Monday. So our different groups can see what the others said, including our GoToMeeting folks. Our GoToMeeting folks probably have a few people who are mixed with the other teams, so it'll be really interesting to see how their responses line up with their other organization folks. And the other thing that we're going to ask you to do is to try and figure out what the prevalence of ASD is for patients in your clinic. And some of you, like we just said, are going to be a little different how you're able to do this. But we'll have some information for you on how to do that will get sent out in the resources of the month. And then next month, we will continue this theme, and we'll do another small group exercise to kind of continue on this and see what we're learning.
Your meeting has ended.